what we're going to do, just to kind of lay out the next segment, we started doing this last year, and it was a big hit, and I loved it. And what we've done is, Neely, Tim, and Joey from Environ, Crystal Clear, and Sciton, these are our 3 original vendors, our OGs. They have been with us since the beginning, and they've been around for a long time. They know a ton about this industry. And so what we thought we'd do, what we have been doing, is featuring them what we call a Hot Topics panel on trends. And really the idea here is to explore what's hot in the industry, what is trending in the industry, what people are looking for. Just by kind of way of context, these folks go to, we put on 8, 9 meetings a year. Tim goes to 80 or 100 around the country. So they are talking constantly to people about what's going on, what's happening. We think it's a very valuable way to understand kind of what's shaking in the industry, what's new, what's different, and what can make you money and what they learn. So how I want to start is, let's just start here with you. Just take 30 seconds, introduce yourself, and then from your perspective, what you think is the hottest thing in the industry right now. And by the way, it's meant to be interactive. If anyone has questions anytime, just raise your hand, speak up, and we'll get you an answer. Go ahead.
Right, so Alex said, my name is Joey Cassera, I work for Sciton. I've been in the industry with Sciton for a little over a year and a half, have a little more extensive of a background in medical sales, but relatively, I guess, new to the industry. One thing that you guys kind of hit on, and I'm in the same boat, never thought I'd be up here in front of a group of people talking about it, but that's really popular right now is vaginal health issues. Vaginal rejuvenation market is something that we think is going to be very big in the coming years. The technology's there for it. It's just, at this point, it's a matter of education. Stuff like this, making people aware of the issues that can be treated and what we can do to help women's issues move forward.
I want to come back to that once we get through, because this vaginal rejuvenation is every time I say that. It's a very fast-growing, lucrative procedure that gets incredible patient satisfaction. And we'll talk a little bit more in a second, but I want you to think about that, because as you look to add treatments, as you look to differentiate yourself, right, and become, find that market, that's something to look at. Tim, take it away. What's new for you?
Yeah, well, first of all, great to be here. And like Alex said, we love the American Medical Spa Association. We've done 8 meetings 4 years in a row, so I guess this is my 33rd meeting by attending. And I do try to get to about 50 shows a year. So what's really cool is I flew here from Las Vegas, and I was at what's called the HIMSS conference. And the HIMSS conference is the largest, and all the technology folks who are involved in elective medicine or elective medicine, which is what we're in the elective medicine space. We had some great meetings with them talking about that, and there were really great themes. We had about 15 meetings over 2 days. We talked with some of the, a lot of the folks that you would know, the largest EMR providers in the space, and the main issue that they all are aware of is consumerism of medicine, right? The consumer has choice. And so these companies that for their entire life have been on the insurance side of medicine, and now understanding that as people have more choices, they need to put integrated platforms together to cater to the cash-based elective practices that have historically been ignored by big technology. So they're all aware that you guys are going to be doing an amazing job. They're all aware that this is where the money is going forward in choice, and not just med spas, but also integrative health, so things like medical weight loss, hormone replacement. Consumers have choices, right? And so the large tech players are now looking at this sector as a place that they know they need to invest money and create tools for you guys to use that can speak to each other. So that was a huge trend, and we'll talk more about that later. And then, of course, always on everyone's mind is the proliferation of social media, both on the consumer side and on the provider side, and how to leverage that. And that was kind of the buzz that everybody was talking about.
There's a lot of resources out there for you guys to go out and educate yourself, to see things hands-on. So, I think it was Brian talking about it earlier. Take some of those days out of the office and go commit a day or two to a training. It might not be something that you want to do on a Saturday. If it's nice out and you want to spend the day outside, you might not necessarily want to be there, but in the long run, it's going to pay off for you because all you're doing is educating yourself further. And you never know where you're going to be. You might be thinking that you want to be in one segment in lasers, one segment of it when you start off, but you never know down the line if things are going well and you're looking to expand. It's always good to have that extra knowledge in your back pocket.
It's so important to do your homework on these things. And one thing I always kind of cringe at, laser reps, present company exclusive, have kind of a tough reputation in this market. There's a saying, you ever want to get rid of a laser rep, just buy a laser from them and you'll never see them again. Not true, but it's important to do your homework and to check. If they're pressuring you, which doesn't happen a lot, but if it does happen, you want to make sure that you take your time, do your research. This is a huge investment. Don't do things in a rush. It's super duper important. And talk to everybody. And here's the other thing. There's different companies that fit different med spas better. It just depends on where you are in your life cycle. You might want to get something to start, and then you might want to do something different. It's totally fine. Tim, I'm amazed that you're in the digital marketing industry because talk about a competitive industry. There are so many of these website makers, social media posters, all this kind of stuff. How do you differentiate yourself? And what advice do you give to people when they get attacked from all angles from people in the industry and without? How do you choose somebody, number one, to go with? Number two, what's the benefit to choosing somebody at all versus doing it yourself?
Yeah, those are all great questions. And so, and we see people at every end of the spectrum, right? So from the advanced, well-established plastic surgery practice to the startup med spa, 35% we work with over 400 clinics, and 35% of those are med spas at various stages of development. The one thing that I will say is counterintuitive, and it really, and just so you understand it, as I look at our portfolio inside our company, the highest churn rate we have is in med spas. So in other words, if we have a 92% retention rate with plastic surgeons, it's in the mid-70s with med spas. Not because of performance, it's because the folks who were starting that med spa didn't prepare for what really is going to take to get the business launched, sustainability, and so they just canceled their non-payment. And the conversation we always have, and this is really important, if you're going to spend $500,000, $750,000 to open up a clinic between lasers, build out, leases, employees, insurance and all that, and then you get to start having conversations with people like me, and you say, well, I've spent, and if this is your talk track, you're already in trouble. If you say, I have spent so much money getting this business open, I don't have a lot of money left for marketing, you stop what you're doing. Spend less here because you need customers, right? So the first issue is to realistically build into your budget X amount of dollars to market, and don't wait. If there's a lot of people in this room who are getting ready to open up, don't wait till day one to start to contemplate how you're going to get patients. You've already missed the whole boat. And if things go rocky the first 3 to 6 months, the first thing that your tendency would be to cut non-core. You'll cut marketing. Well, if you cut marketing, and 80% of your customers, it's guaranteed, 80% of your customers are going to come from the internet, and you stop marketing on the internet, you're dead. So you have to, as you plan, and you're creating a business plan and getting ready to build out your practice, ask yourself, how am I going to get patients? Where are they going to come from? Right? And the friends and family thing will get exhausted quick. So the questions that you should be asking when you're choosing a digital marketing provider is, if someone is trying to convince you that they're really good at design, and they're talking about design and fonts and pretty letters and pages, that's what they're good at. But if someone is talking to you about business analytics, so as you contemplate your digital strategy, you have to understand that it's an ecosystem, part of which is a website, part of which is SEO, part of which is email, part of which is social media, part of which is analytics, part of which is, and then once they fill out a form of call to practice, what software you want to use to actually integrate with your site so that you have automated marketing happening so that when that person fills out a form on Monday, come Friday, some software is chasing them, right? So, and if the challenge you have, and again, this will happen a lot, is you'll have a friend, sister's, brother's, father's, mother whose son's in college, and he'll build you a website for free and do 3 social media posts a week, and you think you're all set. Well, if you think that you're going to compete in the aesthetic industry with a part-time kid doing your marketing, that's not a thing. It's actually not a thing, right? Because it's a zero-sum game. You're going to go into a very, you think I'm in a crowded market. You're going to go into a crowded market, right? And there's only 2 ways you're going to get patients. New patients come into the system, meaning someone who's 22, 23, 24, doesn't have a provider, or you're going to have to steal patients from existing providers. And if you think a well-established plastic surgeon who owns a med spa is going to give up his patients easily, you're crazy. And if he's ranked for everything on page 1, first position on page 1 of Google, how are you going to take those people? By a part-time kid working out of his dorm room? This guy's got a whole market, right? And so when you're really looking at that, the one, you cannot underestimate the importance. It's mission critical. Just like bathrooms and Botox, having a digital strategy in place will make or break the success of your practice.
We'll talk. I'll show you tomorrow morning in my initial talk of the day. I've got some numbers for you. Some of these med spas that are making $3 million a year, spending 7% on marketing. You know, think about what that is. We're talking several $100,000 a year that they're putting into all this.
And you're going to fight those people.
And you've got that's your competition. So I'm not saying you need to do that. I think there's enough volume of patients out there. There's enough people coming into the market, but you've got to be conscious of that. You have to be, otherwise you're going to. There's no way you're going to make it. And Neil, I kind of 2 questions wrapped into one. You know, skincare. There's a ton of skincare brands out there. It's also very competitive. But you know, one thing that we teach a lot of in these boot camps, and that we see in a lot of successful med spas, is this mindset that if you sell skincare, it enhances your bottom line. People come back. There's more benefit to it. But the biggest complaint that I get from people is online sales, or sales on Amazon, or Walmart, or wherever it is. Why should I have a brand in my med spa, but they can go on Amazon and buy it for cheaper, right? So how do you deal with that? If you're a med spa, just kind of in the whole grand scheme of things. And then kind of the second part to that is it's the private label, right? The other thing I see is I want a private label. And it's an ego thing for a lot of people. I'm not saying that it's not a good idea for some people, but for a lot of people it's just, oh my God, I want my own brand. You know, talk about that and what the differences are between a private label and a brand like yours or anyone that we have here.
Yeah, no, that's a great question. I get asked that on a daily basis. Many of your skincare companies do sell online, so your esthetician or your clinic care coordinator spend time doing the consult, recommending product, and they go, oh, they take your list and your prescription card and they go online and go, I can get this on Amazon or eBay. I can say that Environ, our company, we are doctor owned by Dr. Fernandez. His mission in life not to find us online. We do not sell to your larger derm store, Skin One. We just do not allow those sales. If you see anything that's out there, it can be an individual seller. It's not us selling to them directly. You know, you have to ask your companies that you're partnering with what their philosophy is on online skincare sales. A lot of companies do promote it.
Yeah. I have a question, because maybe I didn't phrase it right when I went to talk to you. I remember in school, one of my instructors was saying that in order to be a successful, to have a successful spa and esthetician practice is to be able to provide something that they can't take home and do themselves. And there's so many things out there now where there's microneedling kits, or there's even something where you can actually extract a mole. You know, you can buy it online and extract a mole. So my question is, with that microneedling,
Right.
how can I use that product if they can microneedle at home?
So we have some cosmetic rollers that we were discussing.
Mm-hmm.
Our cosmetic rollers are meant to be at-home use only. It does not negate what you use in the office for skin pen treatment of any kind. They're cosmetic rollers. They're not medical or surgical. They're not even the pin. So it's only penetrated to a certain level. So the only thing that our rollers do are cosmetically, it enhances your products. So it's like aerating your lawn, before you fertilize, to make sure that that fertilizer gets into the grass nice and good before the rain. It just helps penetrate the product. They're meant to be they're cosmetic rollers only. They're not going to correct, they're going to help some texture and fine lines and basic superficial, concerns, but anything that goes deeper, they're going to come to the office. So the rollers are only meant to be used to enhance the products. So think of it just like working out and eating well, right? The two go together. If you've got a goal of it's a new year, new you, you're going to lose 20 pounds, you're going to eat well, you're going to go to the gym 3-4 times a week, it all cohesively works together. So that's what the cosmetic rollers are for.
You know what? It's all about education and educating your patients when they come in. And these three are like phenomenal salespeople, and if you talk to them, they know what they're talking about. If someone comes into your clinic and you're saying, well, here's what the at-home stuff does, here's what ours do, here's what the skincare that we have that's developed by a doctor, tested on his white papers, here's what the Evian skin cream you can get at CVS does. Like, it's a different way of approaching it. So you have to sell them. That's how we talk about sales. It's about selling them on your products, your system. And Tim, you always talk about that aspect of this. It's the belief, right? It's the belief that these people are better off buying products from you at your facility with your doctor because you guys are the best, right? Talk about kind of because the way you phrase it is better than the way I phrase it, I'm sure. Yeah, well, and Tim, by the way, is like the best salesperson in the history of salespeople. So he knows what he's talking about.
I'm just trying to make you today. No, so from a skincare perspective, and it's really true that, so the other day we work with all these different practices, and we can do a phenomenal job driving all the traffic in the world. We can be the best that we can be, but at the end of the day, it all happens at the front desk, right? That's where you win or lose. The phone is the most underrated business tool in the world, and people spend so little time talking about how to talk on the phone and convert people that it's actually some ways disheartening. But to Alex's point, so when we're dealing with a practice and you have people at the front desk say, well, I wasn't hired to be a salesperson, I'm really not salesy, I'm not. Well, to me, it's not a sales issue, it's a belief and a heart issue. And so then we would ask the person, well, number one, do you believe that this is the right clinic to be serving this customer? And if they say no to that, well, wait, it'll work somewhere else. So yes, but I believe that. Do you believe that this provider is the right person to provide the treatment? Yes. Do you believe if they go across the street and go with someone else, there's a chance that they would get less of a result? Yes. Do you believe that adding environment to your clinic and prescribing that to the people who go in and get skin treatments, that they're going to get a better result long term? Yes. So it's not a sales issue, it's a belief issue. Because if you would believe that, it wouldn't be, just one more thing you might want to think. It would be, by the way, this is our protocol with the treatment you just had. These are the 3 products that work best. Here are the before and afters. You want this one or this one. Because if you don't do that, what are they going to do? They're going to leave your practice, go to Sephora or CVS, and they're going to buy stuff that's not going to help what you've just done. And they've just wasted $1,200, and you're not helping them. So if you're not doing that, you're actually letting the customer down. And if you or you have people in your practice who are wavering in their ability to say to the person, this is what, no, they can say, I don't want to do that. I'm not spending another $100 today. Okay, great. But this is what we recommend. And it has to be, it's got to be part of the culture of your practice. It's cultural. And they have to believe that. If they don't believe that, again, you're going to be in trouble. Because if you're not willing to ask to give them the right skincare, then you shouldn't be doing chemical peels. Because someone who did the chemical peel and has the environment product they're actually better off than them. And you have to process that.
We actually had another woman we worked with named Terry Ross out of Beverly Hills. Their med spa, what they do is you come in for a procedure, their protocol is you start with skincare to prep your skin. Here's what we recommend, use this for a week or 2 weeks at a time, and they sell them ahead of time, right? And it's literally a protocol. This is how we do it. And if you want to come out for and get the best result from us, this is what you're going to do. You're going to follow. And so it's the minute they walk in the door, and they're very, very successful.
Alex,
Yes,
to
Jen.
help you guys, I think it's really important that when you're creating this culture, right, what's going to make you different from everybody else it's kind of that total office call that us reps call. Your office has to have that same philosophy. So that moment that patient walks in, they're greeted by a receptionist that understands the science and knows some of the pearls about, your laser or your skincare or the fillers. So you have to incorporate a total office call within your own kind of family, your own business, and that whole philosophy of convert, recruit, retain. It's a circle, it's a cycle. It's like a merry-go-round that your patients can get on at any given point. It can be, because I told Tim that Lynn's Med Spa is great, so then now he's going to go and check it out. It's that convert, recruit, retain model. It's very important that you as business owners embrace that philosophy, because it's going to ensure your patients don't go down the road. Because if you believe in your product, they're going to jump on that merry-go-round at any given point and go, oh, you have lasers, you have wheels, you have other things, maybe what they just came for. And when you give all your office the tools to make it successful, your ROI is going to, you'll be part of that success story at the end of the year.
It's not important that you embrace it, it's mandatory. Like if you don't, that's where you're going. Did you have a comment?
Yeah, I just wanted to add into that too. I mean, also coming from a sales background, I think Pat touched on it a little bit, but I think another key thing here is that you want to be able to work, there's a reason why you have reps there in place. You need to work closely with them to help develop those protocols, to build legitimacy for the products and the services that you're offering. So for example, look for vendors who have years and years of patient outcome data. Look for vendors who are trying to produce clinical on-label uses for the products, and not just typical distributors. Those are really key for helping you build out, I think, as well, successful medical spas.
And you know what? I give a lot of talks before plastic surgery societies. And I go up there and I talk. Oftentimes, I'll have surgeons come to me afterwards, and they're either very mad or very happy, because I'll say, look, the bottom line is that non-core doctors are kicking your ass in the med spa space. It's not even close. Because surgeons and derms especially have trouble, especially derms, with this mentality of selling. It's just, to them, it's medicine. You don't sell medicine, you treat a condition, right? You have something that comes in, I treat you. But that doesn't work when it's all voluntary. It's all, you don't have to get Botox. You don't have to get it. You want to. So you're competing against the decision to get it in the first place, and then all the other places that are out there. So you literally, if there's one thing to take away from this conference, if you're going to get into this space or if you're in it, you really have to change your mindset away from being a doctor's office to having a culture and a system in place where everything is designed to convert that patient from one level to the next. And I think this is a great time to go to what we were talking about before, because vaginal rejuvenation is out there, right? It's an incredible procedure that the success and the patient satisfaction on like Real Self and the review sites is off the charts. It's like 95, 96%, which is unheard of in anything. And it's increasing. We're seeing more and more sales, but still, in the grand scheme of things, it's very, very low. And the reason is how do you sell that, right? How do you put that out into the world? And I'm kind of curious, just what are you seeing in the world of med spa, particularly for how people are dealing with that? How do you get the word out? How do you train people to sell vaginal rejuvenation? Go.
Right. I mean, it's a difficult issue to talk about at first. Women's health issues are not new. I mean, they've been out there. I'll be honest with you, I was not very familiar with a lot of them until I started doing my research. but they're out there. It's just now in you know, with lasers specifically that we're in, that the technology is getting there that we can treat those issues. And you know, going along with that, people are starting to talk about it. So I just want to hit on the market really quick, just because it is relatively new. Like I said, it's small in comparison, but I think it's trending in the right direction. So right now, just out there's 53 million women that are in the target population alone. And when we talk target population, we're talking women experiencing menopause or menopausal symptoms, you know, anywhere from 48 to 55. But there's just as many, if not more, women experiencing issues that are not being talked about outside of that target range. So the population is there for it. In 2016, which is kind of when the technology took off, the global sales for vaginal rejuvenation and in that market exceeded $100 million. $100 million sounds like a lot of money, but in the grand scheme of things, like you said, it's a drop in the bucket. But in the next few years, they're expecting a rise of at least 25% in that market. So a lot of people are making the push there right now. And again, it's one of those things. It's education. If I asked a lot of the men in this room, you know, are you familiar with the symptoms and the issues that women are dealing with? I don't know if you guys are better at this than I would be, but I wouldn't have been able to tell you, you know, the main vaginal or women's health issues that people deal with. Going straight along with what they were saying, you would assume that the people getting into this market would be people that are already in the market, that are well versed in it and know how to bring in patients and then know the technology behind it. But for us, what we're seeing, it's almost 10 to 1 non-core doctors that are getting into vaginal rejuvenation, meaning non-OBGYN doctors. So whether that be internal medicine, plastic surgeon, we even have some people that are doing really, really well with it that are, you know, they're from the orthopedic world. But they've educated themselves and they hired the right staff, going along with a lot of what these other guys are saying. They're hiring the right people that know how to sell within their practice. So I mean, when we're talking about vaginal rejuvenation, women's health, I just want to go over just a couple of the, you know, what's the treatment for? What can this do for women? And it goes from everything from, you know, body-changing events. Obviously, childbirth is something that's an issue. You deal with certain things after having a child. Anything from hysterectomy to chemotherapy. Chemotherapy brings about quite a few different issues that I wasn't familiar with. And then obviously menopause and menopausal symptoms. Some of the symptoms of atrophy, you know, it goes from dryness to burning, dyspareunia, which is discomfort with intercourse, vaginal laxity, and urinary incontinence. Incontinence is a really big one. Some of the other options that were out there before this stuff is coming around, I mean, you're talking about non-hormonal treatments, anywhere, you know, creams, moisturizers, stuff like that. But when you break it down, you find that a lot of people are already spending quite a bit of money on the stuff to take care of it. And that's one of the issues, you know, people come up with some of the laser services that are out there right now. You know, they want to talk pricing on treatments and stuff like that. Really dig in and find out what their issues are, because they could already be spending quite a bit of money on other treatments that might not necessarily be getting them the results that they're looking for. So, I mean, when you talk hormonal treatments, people can be spending anywhere from, you know, $600 to up to $5,000. We found people for stuff like that. For urinary incontinence, bladder medications, you know, you can be spending anywhere from $25 to $300 a month. The 80% of women, a vast majority of women, stop using these medications after 1 year due to either price or side effects. So if that's something that's an issue, we definitely want to talk to them about the new technology that's out there. And then everything from physical therapy, injections, and before this stuff, you know, a lot of them were looking at surgery to take care of some of this. So,
And this is like your target market. These
Yeah.
women are coming in anyway, right? They're coming in for Botox and fillers anyway. What I've always found interesting is there's been studies where it's difficult to market it. Like it's tough. But when you get someone talking about it, and then you get someone to actually perform it and have it, they will then tell their friends, and the word of mouth is off the charts.
So word of mouth is probably the number one way to market this right now. I mean, you can do the brochures and the education and all that stuff. I wrote something down that Brian said in it, or Tim said, and it goes right along with not only vaginal rejuvenation, but any service that you have in your office. Win and lose at the front desk, I think that's huge. As far as vaginal rejuvenation goes, if you're not marketing to it and you're new to it, any woman that might be in the target population that comes in, that should at least be a conversation. That might be the most difficult part of it for some of you guys getting into it, but ask the questions. Because if you get them talking about it and they have some of these issues or symptoms, or they know people that have these symptoms, they'll talk to you about it. And the target population is out there. So,
Or if you're uncomfortable with it, then find someone who is comfortable.
Exactly. You got to be able to ask the questions, and then from there you can kind of start to see what people are, the feedback that you're getting, the symptoms that they're dealing with, and educate the people that are in your office. Majority of the time you see a lot of women, obviously in medical spas. Have that conversation with them, see if that's something that might be interested in, and in turn they'll be able to correlate and talk to the patients about that as well.
Does anyone have any questions? Yes, yes, ma'am.
I originally looked at this, and I think for some reason in my mind it had to be performed by a physician. Has that changed in the industry, or is it still just
Versus
mid-level?
No, it doesn't have to be a physician that does it.
We're actually going to talk more
Well,
about
I
that.
remember originally, I think even OBs were the only ones that could buy it, sort of like, there's some, people who weren't in an OB office, I was like, move that off the table.
Yeah, no, it's I mean,
The restrictions have
the
lifted.
majority of people that are doing it are not doctors doing the treatment themselves.
Yeah, that doesn't make much sense based on the price.
I have one in my garage.
It's
Clean now, like vacuum all the time.
It's really elegant.
We got a big sign on the front of the house.
Garage.
Is there a question?
He has garage parties.
Park here.
We live in a crazy neighborhood.
Botox and vaginal rejuvenation.
Yes.
So having that treatment, I had it done somewhere else, and then I also heard of it, and then I worked last week, but just knowing that you have to be in the stirrups, I don't know, whenever I think of that position, or
Yeah.
if there's another way you can do it without those, I mean, I think it's a great treatment, but just knowing that you have, I'm going in to do that, it's anxiety provoking, I think, a little bit, so.
I think, I think the trouble that people are having is figuring out how to just sell it. Because I think you're right. I mean, I think of that, gives me the heebie-jeebies, and I'm a man, right? It's to me, like, but the thing that I always come back to is the people who have had it almost universally say it made an incredible difference in my life. Like, it's literally a life-changing procedure. There's not a lot of things you can say, that are life-changing. Botox, it makes you feel better. That is, like, it actually does things that change their life. And so there's got to be a way through innovations and being smart, we're talking about it, to figure out how to market this so that people can figure out how to do it. Yes?
The best way to market it really is through educational
I
events.
think so. Let's just
That's
get
the
people
best
together.
way.
Bring a friend, talk to
Bring
somebody.
a friend, you talk about it, and then you educate people on how it changes their life. Because I don't even like the name